Human metapneumovirus or HMPV is a respiratory virus that infects the lungs and airways. This virus is part of the Paramyxoviridae family, which also includes other significant respiratory pathogens like the respiratory syncytial virus, RSV. HMPV can cause a range of respiratory illnesses from mild cold-like symptoms to severe bronchitis and pneumonia. It was first discovered in the Netherlands in 2001. Researchers identified the virus while investigating respiratory infections in children. This discovery was a significant milestone in virology, as it added a new member to the list of known respiratory viruses. HMPV is actually a relatively new discovery in the world of viruses. Despite being identified only recently, studies suggest that it has been circulating in the human population for many decades, possibly even centuries. Even though it was just discovered in 2001, it is thought to have been around for much longer. Historical medical records and recent genetic analyses indicate that HMPV has likely been causing respiratory illnesses for a very long time, but it was only with modern technology that we were able to identify it. HMPV typically causes mild, cold-like symptoms in most people. These symptoms can include a runny nose, cough, sore throat, and fever. In healthy adults, the infection usually resolves on its own without the need for medical intervention. However, it can lead to more serious complications, especially in young children, older adults, and individuals with weakened immune systems. In these vulnerable groups, HMPV can cause severe respiratory issues, leading to hospitalization, and in some cases, even death. HMPV is a common virus, and most people will have been infected with it at some point in their lives. It spreads easily through respiratory droplets when an infected person coughs or sneezes, making it highly contagious, especially in crowded places like schools and workplaces. There is currently no vaccine for HMPV, but there are steps that you can take to reduce your risk of infection. These include practicing good hand hygiene, avoiding close contact with sick individuals, and keeping your living environment clean. By taking these precautions, you can help protect yourself and others from this common yet potentially serious virus. HMPV often presents with symptoms similar to those of the common cold. These symptoms can include a runny nose, cough, and fever. The cough associated with HMPV can sometimes be persistent and linger for several weeks. Other symptoms can manifest as well. These include sore throat, body aches, and headache. In some cases, HMPV can also lead to earaches, particularly in younger children. Wheezing, a whistling sound during breathing, may also occur, indicating inflammation in the airways. HMPV spreads through respiratory droplets released into the air when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect individuals within close proximity. Direct contact with these droplets, such as when someone coughs or sneezes directly on you, poses a high risk of transmission. The virus can also survive on surfaces for a period of time. Touching a contaminated surface, such as a doorknob or toy, and then touching your nose or mouth can lead to infection. This is why hand hygiene is crucial in preventing the spread of HMPV. Preventing the spread of HMPV involves adopting simple yet effective hygiene practices. One of the most important measures is frequent hand washing with soap and water for at least 20 seconds. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used. Covering your mouth and nose with a tissue or your elbow when coughing or sneezing helps prevent the spread of respiratory droplets. It is essential to dispose of used tissues properly and to wash your hands immediately afterward. Avoiding close contact with individuals who are sick, especially those exhibiting respiratory symptoms, can also reduce your risk of infection. Section 5. Current situation and detection of HMPV. HMPV is a common respiratory virus that circulates worldwide. It typically peaks in the winter and spring months, coinciding with the cold and flu season. In recent years, there has been an increased awareness of HMPV, leading to improved detection methods. Laboratory tests, such as polymerase chain reaction tests, are now commonly used to diagnose HMPV infections. These tests are highly sensitive and can detect the virus's genetic material in respiratory samples. The increased use of these tests has provided a clearer understanding of HMPV's prevalence and impact. Section 6. Impact on vulnerable groups. While HMPV generally causes mild illness in most individuals, certain groups are more susceptible to severe complications. This virus, which often presents with symptoms similar to the common cold, can be particularly dangerous for those with compromised health. Young children, especially those under the age of 5, are particularly vulnerable due to their developing immune systems. Their bodies are still learning to fight off infections, making them more prone to severe reactions. They may experience more severe symptoms, such as bronchiolitis, an inflammation of the small airways in the lungs, which can lead to difficulty breathing and require medical intervention, or pneumonia, an infection of the lungs. Pneumonia can be particularly dangerous, leading to hospitalization and, in severe cases, can be life-threatening if not treated promptly. Older adults, particularly those over the age of 65, are also at increased risk of complications from HMPV. As we age, our bodies become less efficient at fighting off infections, and the immune system's response can be slower and less effective. As we age, our immune systems naturally weaken, making us more susceptible to infections. This weakening can result in a higher likelihood of severe symptoms and complications, such as respiratory distress and prolonged recovery times. Individuals with weakened immune systems, such as those undergoing chemotherapy, are at a heightened risk. Chemotherapy can significantly reduce the body's ability to fight off infections, leaving patients vulnerable to severe illnesses, or living with HIV/AIDS, are also more likely to experience severe HMPV infections. These individuals often have compromised immune systems, making it harder for their bodies to combat the virus effectively. It is crucial for these vulnerable groups to take extra precautions to avoid exposure and seek medical attention promptly if symptoms arise. Section 7. Importance of medical consultation. It is important to note that the information provided in this essay is for general knowledge and informational purposes only, and it is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you are experiencing any health concerns or believe you may have HMPV, it is crucial to seek prompt medical attention from a qualified healthcare professional. Your doctor can assess your symptoms, provide an accurate diagnosis, and recommend the most appropriate course of treatment based on your individual circumstances. Self-treating can be dangerous, and seeking professional medical advice ensures you receive the best possible care. Section 8. Living with HMPV, a look ahead. As we continue to learn more about HMPV, researchers are actively working on developing vaccines and antiviral treatments specifically targeting this virus. These advancements hold promise for preventing and managing HMPV infections in the future, particularly for vulnerable populations. In the meantime, practicing good hygiene, staying informed about the virus, and seeking timely medical attention when needed are essential steps in mitigating the impact of HMPV on our health and well-being. By staying vigilant and taking proactive measures, we can reduce the spread of this common respiratory virus. Section 9 conclusions. Staying informed and healthy. Human metapneumovirus, or HMPV, is a common respiratory virus that can cause a range of symptoms, from mild cold-like illness to more serious complications in vulnerable individuals. It is particularly concerning for young children, the elderly, and those with weakened immune systems. Understanding the nature of HMPV and its potential impact is essential for everyone, as it helps us take the necessary steps to protect ourselves and those around us. While there is currently no vaccine for HMPV, simple hygiene practices such as frequent hand washing, covering coughs and sneezes, and maintaining good respiratory hygiene can go a long way in preventing the spread of the virus. These practices are not only effective against HMPV but also help in reducing the transmission of other respiratory infections. Avoiding close contact with sick individuals is another crucial preventive measure. If you or someone in your household is feeling unwell, it's important to stay isolated to prevent spreading the virus to others. This is especially important in communal settings such as schools, workplaces, and public transportation, where viruses can spread rapidly. Staying informed about HMPV, its symptoms, and prevention strategies is crucial for protecting ourselves and our communities. Educational resources, such as health pamphlets and community workshops, play a vital role in spreading awareness and providing valuable information on how to stay safe and healthy. By understanding the virus and taking appropriate precautions, we can navigate the challenges posed by HMPV and promote a healthier future for all. Community health initiatives and professional medical advice are key components in our collective effort to combat the spread of HMPV and other respiratory viruses. Remember to consult with your healthcare provider for any health concerns and to receive personalized medical advice. Regular checkups and open communication with healthcare professionals ensure that you are well informed and prepared to handle any health issues that may arise. Staying proactive about your health is the best way to ensure a safe and healthy future for yourself and your loved ones.